What's interesting when I read up about the work that you do is cause that you've taken up to solve a problem that people quietly live with every day.
When I went to this larger facility of this hospital and I shared the health ID and asked them to access the records, whatever they have, they said, no, we don't have. So we need the physical report which is available. Then I thought, I was surprised. See, the health ID is supposed to actually carry the medical records. Cancer treatment is a big journey. So we have to go through that carefully. Then the thought did occur to me. I have multiple patients, multiple medical situations, multiple records, and where I need to organize them. So if I'm not organized, I'm not going to give them proper care.
And I remember my mother having stacks of records from different hospitals in a diagnostic center or something the doctor has written maybe 3 years ago. And all of that constantly had to be referred every time a new stage of treatment came in.
We need a solution for this, and we need to look at technology, whether it can help us. That's where the thought for IndusAyush occurred.
Hi, my name is Anuj Kurwara. The buzzwords today are innovation, AI, technology, healthcare. But in all of this conversation, the real question still remains: what actual problem are we trying to solve for the people? Now, this conversation that I'm going to get into, which I'm really looking forward to, is not a product pitch or selling something. It's more a conversation about the ecosystem that we exist in and the gaps that someone is trying to fill. This gentleman has been creating enterprise-grade technology for the past few decades. But he's someone who thinks very deeply about systems, trust, and long-term responsibility. This conversation is about healthcare, data, and security. Let's dive in. Thank you, Mr. Chandrasekhar, for speaking with me. Can I call you Chandra?
Yeah, you can.
Yeah, lovely. So you've been creating technology platforms for the past few decades.
Yeah, that's correct.
Now, what's interesting when I read up about the work that you do is there are no flashy promises. There are no, over the top, this is what we're going to deliver. There's just a very interesting movement, if I can say, that you've taken up, a cause that you've taken up to solve a problem that people quietly live with every day. And specifically within the very vast healthcare ecosystem that we have, with everything that it offers, from treatment to technology. Now, healthcare is basically going to a doctor, getting a treatment, getting a report, getting a diagnostic report or a treatment report. And often, whether it's a small ailment or a large one, we are consulting one hospital at one time and then maybe another doctor and then another diagnostic center. So the information is really scattered and in a lot of places. And what you've taken up is the mission to bring it all together on a secure platform called IndusAyush. And it's just making health information accessible, health records accessible, easily stored and together, so that anyone at any time in an emergency, in an uncertain situation, in a stressful situation, doesn't have to think about the information that they carry. It's all available to them and easily used and accessible and reviewed, not just by doctors and hospitals, but maybe by themselves as well. So is that how you would summarize IndusAyush?
Yeah, so let me begin with where the idea emerged. See, a little while ago, my father-in-law had a medical condition, and we had admitted him in a corporate hospital. And maybe at the discharge, the advice was to undergo a surgery and get treated for that. So we brought him home, and then we went to the bigger facility of the same corporate hospital to just follow up and take an advice to schedule a surgery. So we went there, and what these hospitals usually do is they give us a health ID, and with this health ID, all the records are accessible. That's what we believe. So now, when I went to this larger facility of this hospital, and I shared the health ID, and asked them to access the records, whatever they have, they said, no, we don't have. So we need the physical report which is available. Then I thought, I was surprised. See, the health ID is supposed to actually carry the medical records, and they're saying that they don't have. Then the thought occurred to me that the same hospital, different facility, they're not sharing information.
It was not centralized.
It was not centralized.
Okay.
So that's where I thought, yeah, within a hospital, it's not centralized. Let's see what it is outside. So some of the diagnostic centers also, when actually you do some maybe some diagnostic tests. Once these tests are done, they share a report to you, maybe on your WhatsApp or whatever medium, and this is available with you for only for 5 days or maybe 6 days. So after that, it disappears. So if you have stored that with you, it is with you. Otherwise, it disappears. Now, a little while after, my father also, he was undergoing a treatment for cancer,
Okay.
and he also had a cardiac issue. So now, cancer treatment is a big journey. So we have to go through that carefully and also with a lot of precision and understanding of what the patient will undergo, what the caregiver can help the patient to undergo. Then the thought did occur to me that, I have multiple patients, multiple medical situations, multiple records, and where I need to organize them. So if I'm not organized, I'm not going to give them proper care. So this is where the thought occurred that we need a solution for this, and we need to look at technology whether it can help us. That's where the thought for Indus Ayush occurred.
I can so relate to this because my father, during the last few years of his life, he there were multiple ailments, and he was a heart patient. So every time we would have to treat him for a particular ailment, there would have to be an NOC coming in from, let's say, the cardiologist or the nephrologist, or various specialists had to sign off on it. And I remember my mother having stacks of records from different hospitals and a diagnostic center, or something that the doctor has written maybe 3 years ago. And all of that constantly had to be referred every time a new stage of treatment came in. And it can get very tedious, and we deal with it on a daily basis. For me, at my age and stage, I still have a bunch of medical files in a drawer. If I've had a blood test done somewhere, or maybe I had a viral at one point and I had a report and a prescription of that, it's still there, but they're all in different files. So these two use cases, I can so relate to, the problem that you have expressed, which it would just be so helpful to have all of it in one place, securely and accessible, where I can just refer to it at any point of time and have more context to what's going on but having said that, aren't there a lot of apps already in the healthcare ecosystem? What's the gap that you have identified? Really, I mean, there's so much technology already within the universe of healthcare.
See, today when you have a lot of applications which are available, most of them actually are helping you schedule an appointment with a physician or maybe a specialist, and then you have an online chat with him, and then he gives you a prescription to undergo some diagnostic tests, and then you schedule a home pickup of the sample in the same
Yeah.
application. The test is picked up, and then you get the report, the doctor reviews it, and once the review is done, he gives you a prescription. Now this again goes to the pharmacy who will deliver the medicines to your place. So this is more like a scheduler. This is actually enabling you to handle a relationship, maybe a health journey or a smaller one where you're not going to the doctor, you're not visiting the doctor, you're only using technology as a tool to actually consult a doctor and maybe do some diagnostics. This is happening, this has got a large spectrum of services to be done and somebody to coordinate that. So these applications, they're merely scheduling it for you. There is limited focus on one particular thing. They're doing everything, they're scattered. So now where we come into the picture, what we thought about doing here is to specialize. We want to manage only one space, which is your medical record. We want to focus on this, we want to master it, and we want to excel in this. This is the force behind what we thought about the solution.
Like a specialist that you would go to
Exactly.
for a particular purpose,
Yeah.
not a general physician that's offering all kinds of an initial checkup. The app, I mean, these apps, like you rightly said, are mostly scheduling apps. Really, I mean, they're acting as middlemen between various facilities and the patient.
Yeah.
That's very interesting. But Again, healthcare records storage as a specialized service that you have taken up. It makes me think that the world of healthcare is much more beyond treatment. When we, when you say healthcare, you're not just thinking about, normally we think about, okay, going to a doctor or a hospital and getting treatment. It's a lot more than that. There's more information, seamless flow of information that is important. And that's what I guess the technology has to make easier.
Correct. See, there are a lot of reports that are generated and which are available maybe with the doctor, with the hospital, with the diagnostic center, or maybe in some digital format. They're scattered everywhere. So, what we need to do is organize them, bring them to one place, and then sequence it in the way it is done. And you're able to organize it like that. And so, when you walk into a hospital, for a regular checkup or a treatment, yeah, you have them organized. But when you walk into the hospital in an emergency,
Hmm.
you don't have the file with you first. In fact, if I have to give you an example,
Hmm.
a little while ago, I walked into a hospital in an emergency. I just walked straight from my office into the hospital. My files weren't with me. I went from the office. So what happened? I just opened my IndusAyush application and I showed the doctor, these are the things, medical conditions that I am undergoing. This is the medicines that I am taking. That is how it helped me. So here, treatment starts immediately. The more you wait for the file or the record to come in and the doctor to understand, you are delaying the treatment. Some cases, treatment has to start immediately or rather instantaneously. That is where things change. So we are here, we are able to help you to carry your records wherever you are. Actually, your presence with your phone, you can actually share your records and get your treatment started right away.
So let me ask you a question from the point of view of somebody who uses a regular mobile phone device, has limited use of technology, but obviously, like all of us, interacts with the healthcare ecosystem in some capacity. How would you explain Indus Ayush to this user, and how would they start using it?
Yeah, see, to register, it's very simple. Just put in your mobile number and give your email ID, and you get an OTP to validate the user, and you're good to go. You're registered. And once you just log in, and you can just see the stack where you can store your prescriptions, the discharge summaries, the lab reports, the x-rays and scans. And there's also a tab where you can share this something called quick share. You can share this information to a doctor elsewhere, and then you can share it with a password. You'll actually protect it with a password, and this password is available for him, which he can access the record only for 12 hours. Maybe we might extend it to 24 hours because of the different geographies and the time zones that we have rest of other part of the world. And that's it. You can share. It's a password protected share, and you get the information, you get the opinion, and you have it all recorded in Indus Ayush.
Okay.
It's as simple as that.
And uploading these files and reports and everything is as easy as taking a picture and uploading it.
Yes. So you can actually upload a picture. You can
Hmm.
also upload a PDF,
Hmm.
and you can have both,
Hmm.
and you can store them at one place.
Right.
That's how it is.
That's it. As simple as maybe sending a WhatsApp, really.
As simple as that.
So all I have to do is sign up and start uploading whatever records I
That's right.
have.
Yeah, that's
Like
right.
I can just take a picture, scan it, put it
Yes,
up,
you
and
can
it
put it.
remains there, organized by date or.
Yes, organized by date. Organized by date. You can also organize it by the doctor. You can organize it by the hospital or the diagnostic center. See, once you register, you have three, four categories of information that you can store. One being your prescriptions, the other being your lab reports, the other being your x-rays and scans. Then also you can have your discharge summaries or procedure summaries. Apart from that, you can also store information pertaining to your maybe some tools like tracking your BMI, tracking your blood sugars or BP, which are regularly people wanted to understand how they're responding to a medicine or how they're responding to some food or something like that. So these are things which we actually help you to do. Apart from that, the features that we have added there is you can actually share them with professionals maybe in different geographic locations. Like we all want to take a second opinion. Supposing somebody wants to tell you that you have to undergo a procedure or surgery, and you would want to understand whether it is absolutely necessary. You want to take a reference with somebody who's already undergone some procedure. So you'd like to take a referral, speak to them, and send it. So if the patient, if the doctor is close by, you would like to visit them. Otherwise, you would want to send it by an email. Now you're also worried about your privacy, your security of your information, because you don't know what are the practices the other set of system has. So you are able to send them in a password protected email, and the doctor can review it and he can give his opinion, whatever prescription he wants to do. This is well documented there. Now when we're trying to do this, we are also complying with certain laws and regulations which we have in place all over the world or in India. Like supposing if I were to mention the GDPR regulations, the Global Data Protection regulations, we have complied with them, and also the Indian version, which we call the IDPR regulations, and now the most recent DPDP Act, so Digital Privacy Data Protection Act. Right. So we are compliant with them, and it's not only for compliance that we are actually giving this. Privacy is our right. Privacy is what we need to give it. We respect privacy, and information will always be shared only with your consent.
Because it's health data, it's deeply personal, right? So the security of it, even though it is on an online platform, but complying with all of these regulations, making sure that it is absolutely secure and shared only with the user consent, that makes it more important. Or maybe in case of an emergency, maybe your loved ones have access to it and they can probably show it to the healthcare professional. This is a deep responsibility that any technology service provider needs to think about right at the start.
That's right.
So does this technology also diagnose or suggest anything at all, or is it just purely storage?
It's purely storage, because diagnosis is not what we are supposed to do, because that's what the doctors have to do. We are actually trying to bring in some tools based on AI, which can actually track the symptoms or maybe track your whatever numbers that are emanating out of the lab reports. So these numbers are tracked, and these numbers are maybe you populate a graph, or maybe you actually relate them with some symptoms, and it will prompt you that you can meet a doctor or something like that for a particular diagnosis that you may want to. It's only suggestive, and it is not diagnosis. So diagnosis is not what we should do. Yeah. So we limit ourselves to only storage of data and enabling you to share, take opinions, and protect it, protecting your privacy.
Yeah. And that's best left to the medical professionals to diagnose and make sense of whatever that information is. There is also the notion that any kind of technological advancement that comes in eventually replaces someone or something, right? Now, of course, this doesn't replace a doctor. It doesn't replace a diagnostic center. It doesn't replace anybody in the medical ecosystem. But it does plug the gap of having information stored in a secure way. Who all does this benefit other than the patient and the medical service provider directly?
See, primarily it's the patient and maybe the caregiver who will actually help the patient give them this. And then the doctor who gets the information, timely and reliable information, because you have put it on that. You have sourced it from wherever you have done this. And it is also benefiting maybe we can also think about insurance companies. Insurance companies today need a lot of information when they want to renew what you call a policy. I would like to give an example out here. My dad had a heart attack some time back. So when he was admitted and they were going through the medical records, so we mentioned there that he is diabetic. So the query from the insurance company when actually we were taking an authorization was we don't have his diabetes on record, because when he enrolled he didn't have diabetes. So they asked me for the first prescription when he was treated for diabetes. So I had it handy so that I was able to present it, and so since when he was diabetic, because these insurance companies want to understand the risk that they are assuming because of certain conditions which are there. So the insurance companies might as well benefit when information is available for them that a particular policy holder or somebody like that has this kind of a condition. So this is a proposed one which we want to actually tap that, so that if really it benefits the patient and also the insurance company, that there is transparency of information.
That's actually an incredible value addition because uh, the insurance system is extremely complex and relies very heavily on clarity of information and context of every record that you have. So to have something like this available with past history, any kind of related information, documents, all available on one platform would be a lot easier to navigate insurance claims, insurance processes. So there's, of course, the patient, there's the medical service providers, there's insurance. Now, when a technology company steps in to solve this kind of a problem or fill in this kind of a gap, what are they to the medical ecosystem, to the healthcare ecosystem? Are they enablers? Are they builders? Are they partners or something more?
To me, it appears that a technology company should be an enabler and a partner as well. Enabler in the sense that, yes, these records, we are providing it to you wherever you want it, whenever you want it, and the reliability of the information is always protected, and the privacy and all that. And as partners, because we are thinking from the side of the patient or the caregiver, or maybe the user. Instead of calling the user as a patient, I rather call them as a user.
The user.
So they can always benefit from it, and we can be a partner in their journey, the healthcare, because healthcare is always a continuous journey. So that is where we want people to maintain their medical history, and we would like to be part of the journey by enabling them store their medical records.
It's interesting what you said. Healthcare is a continuous journey. Often it feels episodic.
Yes,
Uh,
it is. Yes,
yeah.
it is. And maybe it is interdependent. See, one for once, somebody might go in with a cardiac thing. So for another time, it might be something else. So, and it is overlapping. It is interrelated sometimes. And as you mentioned earlier, that sometimes for everything, once a patient is into a cardiac kind of a journey, for everything that the doctor might want to do, he might want a cardiac clearance. So that is where we need to provide those reports. So all this, you have to track that.
Often you are expected to go through a battery of tests every time you go into a
True,
hospital,
true.
right? And especially more for serious ailments because they want to constantly check if all the um, the meter, the readings are all okay. But the the availability of information that, hey, I've just had a test, let's say a week ago, and I have that information with me here, and this is a sign off from so and so specialist. I think it just eases that process of the
Correct.
healthcare as
Yeah. So see, most people have their own view or perspective about when a particular medicine is prescribed and
well.
a patient reacts to it or
Hmm.
responds
Hmm.
to it. So they would like to repeat certain tests and do that. So they would always want to relate where it started and what happened after this, what happened with this medicine. So we are actually partnering with you. We're giving you the information and which you can help the doctor treat you better.
Now, with healthcare technology advancing rapidly, uh, and I can't even imagine what the next few years are going to be like. So, if we were to jump forward, say 10 years, especially in the Indian healthcare ecosystem and technology being such a important integral part of it, with service providers like yourself, uh, where do you envision all of this a decade down the line?
See, today there are a lot of apps like we were discussing earlier, and a lot of systems which are there. But one thing is rationalizing these systems where healthcare information is collected and is available to anybody at one place. Like if I were to give you an example of today we are talking about PAN and Aadhaar being linked everywhere to every
Yes.
transaction.
Yes.
Now we need people to have a health ID. Of course, yes, there is something which the government has worked on that, but it's not available to everybody, or maybe people are not aware of it, or maybe information is not collected. Like when we walk in, maybe you're buying some jewelry, you have to quote your PAN card, and then it is reflected in your income statements and all that. Like that, you need somebody to just walk in freely and tell that, this is my health ID. So this my information should sit there, so that wherever I am, this is my healthcare information available. So these kinds of things, yes, today we are talking about it, but I think in 10 years time we should get there.
Like one health ID just unlocks the
Right.
information
So
for
from
anyone.
from the time of a person's birth till wherever he is. So I think if information is tracked like that and it is available, it
Hmm.
helps,
Hmm.
because healthcare, as I said earlier, is a continuous journey.
And not to forget, of course, underlining the huge responsibility that comes with having all of your health information unlocked with your health ID, the kind of security that is required, the respect to privacy that's required along with that. Uh, India is, of course, building a lot of digital public infrastructure. There's a lot of advancements that's happening. Uh, how do you think we are poised to leap forward into the future? Uh, what gaps still exist? What remarkable work is still being done in your experience?
See, thing is, we have to rationalize the information as one thing, and there's a lot of data coming in from new technology advancements, which are bringing in a lot of new equipment, new kind of reports, other than the images or the physical reports. So we need to factor in all that. We have to take the journey ahead, gather that information, be able to populate it, make it available, and of course, as we said, privacy is not just compliance with laws and regulations, it is for something people to trust. Yes, my data is safe here, my information is safe here. And trust is basically, you have to win that trust. People should understand that, yeah, my information is stored here, it is private. And other than medical data, even your personal information, which we actually capture to at the time of registration. So this is also, see, there are a lot of people who actually want to monetize on this.
Yes.
So that is not something which is allowed as per the compliance of the regulations and laws that we have. So, but that is where the trust factor comes in. So that has to be in place.
Like even back end people working on
Yeah,
the
see,
system
like
that you're making.
it's like, supposing you have an account with whatever information you are storing in your ID, and when you make a call and say you want some support on the application, like this report is not opening or something like
Yeah.
that,
Yeah.
the tech support team which works here,
Hmm.
even they will not be able to see the information which you have stored. It's all
Oh.
encrypted.
Oh wow.
It's
Okay.
all encrypted.
Wow.
So that's when we talk about compliance, we talk about encryption. So even the team which is supporting you will not be able to see your personal information or your medical information. These are two different sets which we've ensured that we don't look at it.
Wow. That's it's quite reassuring to hear. And uh, what's the big promise that Indus Ayush offers and will continue to offer?
The promise is privacy. The promise is to make it available to you wherever you want it, wherever you want to present it, and of course with your consent as well. And the promise is that we will be there with you in your journey of healthcare to
Fantastic.
save your life.
Fantastic. I'm walking away with a very expanded perspective of healthcare itself. Like I said, a lot of times when you think about it, you think just in terms of treatment. But to have a technology that empowers you to have information with you, secure, it just gives you a peace of mind, a little sense of reassurance that you are taken care of at the earliest with the information that's available. Thank you for talking to us about Indus Ayush and the work that you're doing at large. This is a very, very important initiative. What I appreciate about this whole conversation, what I'm taking away from this is that my perspectives of healthcare really have expanded. It's a lot more than just treatment. It's more about the flow of information, the ecosystem, the larger ecosystem that we're all a part of. And what's reassuring is that when information flows and it is easily accessible and secure, people would feel more in control, more informed, and more at peace of mind. I guess that itself is a worthy enough result to have out of all of this effort. Um, this conversation was not about hype or over exaggerated promises. It was just very real, solving problems that exist in our everyday life. um, I would urge you, in fact, thank you for watching all this while, but I would urge you to check out Indus Ayush. It's a beautiful initiative that I'm sure you will truly appreciate. Thank you once again for watching, and stay tuned for more.